Some people who had mild COVID-19 infections are now having memory problems. That's according to senior lecturer at Stellenbosch University, Professor Lebogang Phahladira, who also heads the Adult Psychotherapeutic Unit at Lentegeur Hospital in Cape Town. Professor Phahladira joins us now via Skype for more. Prof, when you say memory problems, what are patients experiencing?
Good afternoon, and thank you for having us. I think what we need to emphasize to members of the public is that COVID-19 affects every system of the body. So there are people who present with lung problems such as pneumonia. There are people who present with memory problems. And in particular, the patients who presented in our unit are patients who were struggling to remember. So these patients would struggle to form new memories. They would be able to tell you what happened a few years ago, but they won't be able to tell you how they got to hospital, what conversation they had on the same morning. So, and this is in a cohort of patients who have had COVID-19. Some have had even mild disease. So it is important for the public to be aware that we're dealing with a very, very serious illness, and the virus is dangerous, and we all have to be very careful.
How long do these memory-related symptoms persist? Is it permanent damage?
We don't know yet. Our colleagues at UCT are looking at this further, but reports from other parts of the world suggest that in some patients, after 6 months, they should be able to go back to their normal level of functioning. But what is also unclear is whether this group of patients who would have memory problems now would be those patients that would present with other kind of illnesses like Alzheimer's dementia or other forms of dementia at the later stages of their life. That is still not known.
And where are we in terms of determining the cause of these memory problems as they relate to the COVID-19 infection?
I think the cause is the virus. I think what the public needs to understand is that COVID-19 is a systemic illness, and therefore the same pathology or inflammation that would happen in the lungs, that might happen in the kidneys, would happen in the brain, and therefore leading to damage to some parts of the brain or certain changes, making some parts of the brain a little bit smaller, and those would cause account for memory problems and other cognitive complaints.
So we haven't determined yet what would make one person who is infected with COVID-19 to have specific symptoms that do not include memory problems, and the next person would have memory problems.
So we don't know. We don't know. But what we do know is that it's everybody can get it, male and female. Even patients with mild symptoms, patients who would not necessarily require admission for the general COVID symptoms may present with this kind of memory problems. And our worry is that this may have long-term impact on their cognitive functioning in the long term, even though we are not sure yet what long-term that impact would be. So it is very, very important that we become very careful around COVID-19.
Apart from trying to avoid infection in the first place, is there anything patients can do when memory problems present themselves to decrease the severity or perhaps decrease the damage or shorten their period of effect?
The patients that presented to our unit, had other symptoms that arose as a result of memory problems. So these patients would be more anxious. They would have symptoms of depression. By mere effect of noticing that you can't remember, it has caused great anxiety and depression in many of the patients, and therefore there is no particular treatment for the memory problems, but treating the co-occurring symptoms, that would be depression, anxiety, pain in some patients, that may help probably the recovery to be a little bit quicker.
Well, thank you very much for speaking to us. Not that we feel any better now. There's a lot more to be anxious about with regards to COVID-19. That was Dr. Lebogang Phahladira from the Stellenbosch University.